$202.90 is being deducted from your Social Security check every single month. And for a significant number of people watching this right now, that deduction is legally not required. There are exactly 4 things I'm going to cover: what this refund actually is and why almost no one knows it exists, exactly who qualifies and what the enrollment rules are, how the refund is paid, and the mistake that costs most seniors the benefit entirely, and how to find a qualifying plan before the enrollment window closes. Before we are done, I'm sharing one bonus specifically for seniors who have a spouse also on Medicare, because if it applies to your household, it doubles everything I'm about to show you. Stay with me, because by the end of this, you will know exactly what this refund is, whether you qualify, and the one step to take before the window closes. Now, before I get into those 4 items, I want to address something directly, because I already know what some of you are thinking. You are thinking, I am already on Medicare. My agent or my plan would have told me about this if it were real. Here is why they did not, and I want to be clear right now. This is not about dishonesty, it is about incentives. Medicare Advantage plan brokers earn a commission on every enrollment. In 2026, that commission runs up to $694 per member per year on new enrollments. That commission is paid regardless of which plan you choose, regardless of how much or how little that plan gives back toward your Part B premium. There's no extra dollar paid to a broker who finds you the highest give-back plan in your zip code, so that comparison simply does not happen. The second thing I hear is this. This sounds like something only for low-income seniors, not for someone in my situation. That is exactly wrong, and that assumption is costing middle-income seniors thousands of dollars every year. The Part B Giveback Benefit has nothing to do with your income. It is not means-tested. It is not an assistance program. It is a feature built into certain Medicare Advantage plans, available at any income level, in any tax bracket, to any senior enrolled in the right plan. Whether you are on a Medicare Advantage plan right now, or you are still on Original Medicare, what I am about to cover applies to you. The 4 items coming up will show you exactly where you stand, and here is the part that most people never hear. Medicare Advantage plan brokers do not tell you that the Part B Giveback Benefit exists. The 1-800-Medicare enrollment hotline does not remind you that giveback amounts vary by zip code across competing plans in your area. Insurance companies offering Advantage plans without the giveback benefit do not inform you that competing plans in your area offer it. Medicare itself does not notify you when a higher giveback plan becomes available in your area. 4 institutions. 4 points of contact where a senior could have learned about this benefit, and not one of them has a financial reason to bring it up. Being legally entitled to a refund and actually receiving it are 2 completely different things. The law does not deposit money into your account automatically. No one mails you a check for a benefit you never claimed. My name is Dr. Richard Voss. I hold a Ph.D. in health policy and economics from the University of Michigan. And for 22 years, I worked as a federal and state Medicare policy consultant, advising health agencies and insurance commissioners across 14 states on the exact rules that govern the plans your broker sells you. The most painful pattern I witnessed in those 22 years was not fraud, it was not abuse, it was honest seniors at every income level having $202.90 removed from their Social Security check every single month for a premium they did not have to pay, simply because no one inside the system had any financial reason to tell them otherwise. That is the most expensive kind of mistake there is, because it is invisible. There is no notice. There is no penalty. There is just $202.90 leaving your account every month that never had to. Here is the one idea that connects everything I am about to show you. The Part B Giveback Benefit is not a loophole. It is not a trick. It is not some obscure exemption buried in a regulation nobody reads. It is a legal Medicare benefit written into federal law, available since 2003. The only reason most seniors do not have it is that nobody with a financial stake in the system ever explained that it existed. That is the entire reason this video exists. Item 1. What the Part B Giveback Benefit actually is and why almost no one knows it exists. Most seniors assume their Part B premium of $202.90 a month is fixed, non-negotiable, just the cost of being on Medicare. It is not. The formal name of this benefit is the Part B Premium Reduction Benefit. What it does is reduce, or in some cases completely eliminate, the $202.90 monthly deduction that Medicare takes from your Social Security payment. Depending on the plan and where you live, that reduction can be anywhere from a few dollars all the way up to the full $202.90. Meaning some seniors on qualifying plans pay $0 in Part B premiums every single month. It is only available through certain Medicare Advantage plans. It does not exist on Original Medicare. It does not exist on Medigap supplement plans. And it does not come as a separate check in the mail, but I will get to that in a moment. Here is what this means if you are on Medicare Advantage right now. Your current plan may or may not include this benefit. Many plans do not. In 2026, only 32% of Medicare Advantage plans offer any Part B premium reduction at all, meaning more than 2 out of every 3 plans offer zero giveback to their members. Here is what this means if you are on Original Medicare. You are not eligible for this benefit in your current coverage. But understanding what it is and what switching would involve is exactly what the next item covers. $202.90 is being deducted from your Social Security payment right now. For some of you watching this, it does not have to be. That leads directly into the question everyone asks next, and it is the one most people get wrong. Item 2. Exactly who qualifies and the specific plan enrollment rules that determine eligibility. You might think that if this benefit existed, your current plan would already include it. That assumption is costing people $4,800 a year. Here is what qualification actually requires. You must be enrolled in Medicare Part A and Medicare Part B, both. You must be on a specific qualifying Medicare Advantage plan that offers the Part B premium reduction benefit as a listed feature. And you must be paying your own Part B premium if Medicaid or a Medicare savings program is covering that premium for you. There is no give back to claim. Now here is the part that catches most people off guard. The benefit amount is not the same everywhere. It varies by plan and by zip code. A senior in one county may have access to a plan offering a $100 a month reduction. A senior in the next county over may have access to a plan offering the full $202.90. Same state, completely different outcome. Plan comparison is not optional. It is the entire mechanism. Here is what this means if you are on Medicare Advantage. Your current plan may not be the highest give-back plan available in your zip code. The only way to know is to compare. Here is what this means if you are on Original Medicare. A qualifying Medicare Advantage plan is the only path to this benefit. What that switch involves, and whether it makes sense, is something the fourth item covers in full. Right now, in your zip code, there may be a Medicare Advantage plan that eliminates your Part B premium entirely, and no one has told you to look for it. Stay with me, because the next one is the reason most seniors who qualify for this benefit never realize they have it. Item 3. How the refund is paid and the costly mistake seniors make by waiting for a check that never comes. Now, most people assume this refund comes as a separate check in the mail. It does not. And that assumption is exactly why most seniors on qualifying plans never realize they have the benefit, or that they are missing it. Here is how it actually works. The insurance company does not send money to you. They send the giveback amount directly to Medicare. Medicare then reduces the Part B deduction taken from your monthly Social Security payment. The benefit shows up as a smaller deduction on your Social Security statement, not as a new deposit, not as a separate line item from the insurer. If your Part B premium is deducted from your Social Security check, you should see a reduced deduction amount each month. If you pay your Part B premium directly to Medicare rather than through Social Security, you will see a reduced invoice amount instead. Here is what this means if you are on Medicare Advantage right now. Pull out your Social Security statement, find the Part B premium deduction line. If you are on a qualifying giveback plan, that number should be less than $202.90. If it reads $202.90, one of two things is true. Your plan does not include the giveback benefit, or there is an administrative issue worth investigating with your plan directly. Here is what this means if you are on original Medicare. This payment mechanism only exists inside qualifying Medicare Advantage plans. It is not available in your current coverage structure. If you are on a qualifying plan and that reduction is not showing on your Social Security statement, money is being left on the table every single month. And this last item is the most actionable of all, because knowing about this benefit means nothing if you do not know exactly how to claim it before the window closes. Item 4. How to find and enroll in a qualifying plan before the annual enrollment period closes. Most seniors believe plan switching is complicated, locked in, or requires working through an agent. None of that is true. Every year, Medicare runs an annual enrollment period, October 15th through December 7th. That is the window during which you can compare plans, switch plans, or enroll in a Medicare Advantage plan for the first time. Any changes you make during that window take effect January 1st of the following year. Here is how to find qualifying plans in your specific area. Go to Medicare.gov and use the Plan Finder tool. When comparing plans, look specifically for plans that list a Part B premium reduction in their benefits. That is the line that tells you how much of your $202.90 monthly premium a given plan is willing to cover. You are comparing that number across every qualifying plan available in your zip code. If you prefer to speak with someone, call 1-800-MEDICARE. That is 1-800-633-4227. It is free. Available 24 hours a day. You can also contact your state's SHIP program, the State Health Insurance Assistance Program. SHIP counselors are federally funded, completely free, carry no commission, and have no sales motive of any kind. They exist specifically to help you compare and enroll in the plan that is right for you, not the plan that pays the highest broker commission. Here is what this means if you are on Medicare Advantage. Between now and October 15th, review your current plan's summary of benefits. Confirm whether your plan includes a Part B premium reduction and how much it is. Then use the Plan Finder to see whether a higher giveback plan exists in your zip code before the enrollment window opens. Here is what this means if you are on Original Medicare. October 15th is the first day you can switch to a qualifying Medicare Advantage plan. That switch is your entry point to this benefit. Every year, the enrollment window opens. And every year it closes. And every year, millions of seniors who could have had this benefit did not enroll. That window opens again on October 15th. Now, I promised you a bonus, and I want to be specific about who this is for, because if it applies to your household, it doubles everything I just covered. If you are single or your spouse is not yet on Medicare, everything in the 4 items I just covered already applies to you fully, and you have more than enough to act on. But if you have a spouse who is also enrolled in Medicare Part A and Part B, what I'm about to share doubles the number I put in this video's title. The Part B Giveback Benefit is not a household benefit, it is a per-person benefit, which means both spouses can claim it independently. Here is what that looks like in practice. Both spouses must be enrolled in qualifying Medicare Advantage plans, but they do not have to be on the same plan. Each spouse's giveback amount is determined individually by their own plan and their own zip code. At the full $202.90 per month each, a qualifying couple eliminates $405.80 in combined monthly Part B premiums. That is $4,869.60 per year, returning to your household simply by being on the right plans. Both plans can be compared and enrolled separately during the same annual enrollment period window, October 15th through December 7th. 1 window, 2 enrollments, 2 full benefits. Most couples are told about this benefit for one person. Almost no one tells them to apply it twice. That oversight alone is worth thousands of dollars a year, and almost nobody mentions it. Here is the trap the Medicare insurance industry depends on, and it works on 2 completely different groups of people for 2 completely different reasons. Seniors on Medicare Advantage assume their broker already found them the best plan, so they never check whether a higher giveback option exists in their zip code. They trust the process, and the process has no incentive to serve them on this particular question. Seniors on Original Medicare assume the giveback does not apply to them, so they never investigate what switching would involve. They opt out of a conversation they did not know they were allowed to have. Both assumptions leave the same $4,800 on the table for opposite reasons. The Medicare vault exists for one reason: to make sure the rules that were written to protect you are the rules you actually benefit from. I have put together a free Medicare Giveback checklist that walks you through exactly how to verify whether your current plan includes this benefit and how to compare qualifying plans in your zip code before October 15th. Print it. Keep it with your Medicare documents. Go through it before October 15th. Now, I want to ask you something directly. Think of one person in your life who is over 65, a spouse, a neighbor, a sibling, a friend from church, someone who has $202.90 being deducted from their Social Security check every single month and has no idea this benefit exists. Send them this video. It does not matter whether they are on Medicare Advantage or Original Medicare. The odds are very good that at least one thing in this video applies to them right now. One share from you could be worth more to them than any gift you will ever give.